Welcome to OBGYN Ultrasound Basics. Today's topic of discussion is about adenomyosis, also known as a bulky uterus. Characteristics of adenomyosis include, on the clinical side, menstrual irregularities, heavy bleeding, painful periods, pelvic fullness, or pain with intercourse. On the diagnostic side, as far as ultrasound, we're going to see an increased uterine volume, ill-defined endometrial borders, hyperechoic islands, or myometriosis. Also, the Venetian blind sign is something that we're going to look at as well. So you can have a combination of any of these to come up with a diagnosis of adenomyosis. Here we see the ultrasound appearance of adenomyosis on the right, and on the left is the normal uterus. So you can see how there's a difference between how bulky and rounded the uterus that has adenomyosis is in comparison to the normal uterus. So the adenomyosis is going to oftentimes appear as like bulbous or globular. The uterus is going to be very full, and you're going to see like sometimes it kind of pinches around in the lower uterine segment towards the cervix, and that's a really good indication of adenomyosis as compared to the normal uterus where it's not as pinched at the in the lower uterine segment. And I just say that because that's just kind of how it looks to me. One looks more bulbous and globular versus the other one is a little bit more uniformed and doesn't kind of dip in as much as this one on the right. Again, in ultrasound, we love our ultrasound signs and symbols, and for adenomyosis, we call it the Venetian blind or the vertical blind sign, and that's because you see the contrast in the dark light going throughout the myometrium of the uterus. And for reference, you see the picture of the Venetian blinds on the left, and then the ultrasound picture, if you look in the posterior aspect, this is a transverse view of the uterus. And on the posterior aspect, you can see the dark light going throughout. And so that would be your Venetian blind sign, and that's just what we mean when we say that. These are some images of normal versus the abnormal uterus. So if you look on the far left, this is an image of a normal appearing uterus. You can see it's homogeneous. The texture appears smooth, and it's just uniform all the way around. You look at the abnormal uterus in the middle picture, and you can see that Venetian blind appearance that we talked about in the previous slide. And a lot of times with adenomyosis, you'll have what they call anterior posterior myometrial asymmetry. And what that means is like you don't have the equal parts on the top, or the symmetry as far as thickness on the anterior aspect of the uterus as you do on the posterior aspect. So if you look at the normal uterus in comparison to the abnormal uterus in the middle, you can see that asymmetry even more pronounced because the anterior aspect of the uterus is much smaller than the posterior aspect, where we see there is a greater distance from the endometrium to the posterior aspect of the uterus. And the far right image, again, this is just another uterus that has example of a uterus that has the adenomyosis. So it's not as obvious as the image in the middle, but you can still see the dark light. And then if you were to measure anterior the anterior aspect of the uterus to the the endometrial stripe, you can see the difference between the anterior portion and the posterior portion as well. In the cartoon image to the left, you can see the normal healthy uterus. Again, it's smooth. And then if you look at the image of the uterus with adenomyosis, you see that it is irregular and it's a little lumpy, bumpy in contour compared to the normal healthy uterus. And these little bubbles right here, those are going to be fluid-filled sacs of blood. And so what that is the myometrial cyst that we see here on the actual ultrasound image to the right. So when you see these little cystic areas in the uterus, a lot of times that is a really good indication that that patient has adenomyosis or there's something underlying going on there. But those are characteristics of adenomyosis. You might see one, you may see two, you may see a few. So just very much so pay attention to that, and you don't have to measure all of these cystic areas. I would measure the largest and then keep it moving. These are just normal images of a normal uterus, rather. The longitudinal or sagittal view is on the left, and the transverse view is on the right. And these are both transvaginal images. And you know it is transvaginal because you can see the footprint of the probe here at the top part of the screen. So this is what the normal uterus looks like in the sagittal and transverse view. And in comparison to the previous slide, you have the uterus that has adenomyosis. You can see that it is much more bulky. It is difficult to differentiate the endometrial myometrium border because the proliferation of the endometrium into the myometrium here. So it's just, you really couldn't find anything measurable in this right here. And then on the transverse view, you can see the anterior posterior asymmetry and also the Venetian blind sign. Again, normal uterus on the left. Look at that nice endometrium, well defined. Adenomyosis, you can see that endometrium is ill-defined. So you also can notice how bulky and rounded and globular in appearance the uterus that has adenomyosis is in comparison to the normal and inverted uterus. Normal versus abnormal in the transverse views. Normal on the left, abnormal on the right, and you can see the anterior posterior asymmetry. In comparison, the Venetian blind sign, the dark light on the right, and then the image on the left, normal. And lastly, we've made it to the impression text. So once again, you're going to always say what you see. If you don't see it, don't say it. So for example, this is how we will write a report. The uterus appears enlarged and bulky with a globular shape. The uterine ecotexture is heterogeneous with hyperechoic islands visualized throughout the myometrium. The endometrium appears ill-defined and not well visualized due to the uterine ecotexture. Ultrasound findings are suggestive of adenomyosis. And then you obviously comment on the rest of the report. So again, we're not diagnosing, we're saying that it's suggestive to kind of lead to that diagnosis because we know what we're seeing, and we're just going to comment that basically we think that's what it is, but we're not diagnosing it. Okay. So keep that in mind, and I'll see you in the next video. If you like the video, leave a comment, subscribe. If you have any suggestions, I'd be happy to hear it. I hope you all enjoyed the learning lesson I did, and see you next time. Happy scanning.